Hello, I'm Hartford Healthcare's Tina Verona. A landmark study has revealed promising results in treating a subset of stroke patients up to 24 hours with excellent outcomes. Dr. Amre Nouh is the director of the Stroke Center here at Hartford Hospital. First, thank you for being here.
Thanks for having me.
Yeah, absolutely. This is pretty remarkable. Through advanced imaging and a very defined clinical criteria, that window has grown from 6 hours to 24 hours. Explain that.
Yeah, it's truly amazing. I mean, we've been treating patients all along, looking at time-based windows, up to 6 hours out, because that's what the data we had. This trial, called the DAWN trial, looked at finding that group of patients who have these blockages in their brain from a clot, who may still benefit from getting the procedure done up to 24 hours out. And precisely this study looked at identifying the salvageable brain tissue, or the part of the brain that is at risk of getting damaged from the stroke but is not yet damaged. And clinically, they're having stroke symptoms. And then treating those patients by removing that clot through a procedure called a thrombectomy, where a catheter would go through all the way up to the brain and snare that clot and pull it out. And that study has shown remarkable results, about a 73% reduction in disability. And it's basically going to change the way we look at stroke patients now.
Absolutely. So essentially, you've bought yourself some time here to
Correct.
really look at the imaging and the patient criteria to make sure that, and it is a small subset of patients that can qualify for this.
And and I'm glad you touched on that, because still time is brain.
Right.
Every minute you're losing 1.9 million neurons of brain cells. But there are patients, and we've known all along that the time is a big component, but there's still some ability to save some of that brain tissue that's not yet gone. And finding that group of patients with this new imaging technique, this is software, it's called a perfusion study, and the software is called RAPID, and it could tell us what amount of brain tissue damage is already done, it's irreversible, and that is yet to have
still
viable tissue that you can still treat. And if there's enough viable tissue, and that's what the trial has shown, what amount of viable tissue and what criteria of patients can benefit from that, then we'd go and treat those patients.
Right. And I do want to stress that because, like you said, time is brain. We have that 6 hour window, which is still critical, and people should still follow that and not say, oh, hey, I think I have some stroke symptoms. I'll wait 24 hours or I'll go after dinner. No, you don't diagnose yourself. No. We want to make sure that you still follow that time is brain, think fast, that 6 hour window.
Precisely. Every minute and every second counts, because our options become less and less as time goes. So, within 6 hours, you could get that procedure done potentially if you have a blockage in your brain. But within the first 3 hours or so, up to 4.5 in some patients, you can get TPA, which is an IV drug, clot busting medicine. So the earlier you get to the hospital, the more options there are for treatment, and then the better the outcomes are.
Right. Let's talk about a different group of patients who before there may not have been hope for, but who really can benefit. I think you mentioned 20% of some of these stroke patients, the wake-up stroke patients who have a stroke sometime during the night and wake up with symptoms. You don't know when they had that stroke. But now with that 24-hour window is showing some promising results for this group of patients.
Yeah, wake-up strokes is big. I mean, even in the trial, that was a big proportion of patients who were actually enrolled in that trial, because a lot of times, and we see this all the time, somebody went to sleep and then they wake up with weakness on one side, or a family member finds, grandma, grandpa, mom, or dad, in bed, unable to move, and they don't know when this happened. The patients can't tell for themselves. And typically those patients, because there is no timeline that's clear, wouldn't be candidates for TPA. And I would say the majority of them wouldn't be candidates for treatment with a clot retrieval device. But with this new study that evaluated these patients using this imaging technique, time is not really going to be the main factor. It's going to be if there's enough brain tissue that we can save, and if 24 hours gives you plenty of time to look at that. So that's the group of patients that certainly in the past could not get treated, and now we can at least screen them and evaluate that group of patients who can benefit.
Yeah, that's really incredible. I mean, when you look at this study, and I do want to stress too that these are not guidelines, these are protocols that maybe one day these could become guidelines for for every hospital to follow, but
Right.
we have instituted these protocols here at Hartford Hospital.
Correct. That is exactly right. I mean, the study that was called the DAWN study looked at this. There's a similar study that called the Diffuse trial that's hopefully going to be published as well soon, looking at the same type of thing, and usually the guidelines follow. They look at the evidence-based medicine that's out there and make recommendations based on the results of trials. So we're anticipating to hear some guidelines, but in real time now we're able to do the stuff that's been done in this study here at Hartford.
Which is amazing, and that's got to make you feel good too,
It's
as
great.
a neurologist, right? That you're
Absolutely.
able to help this a group of patients who otherwise would not have benefited from treatment.
Yes, we have, and we've already started implementing some of this, and we've had our own experience here. We've treated a group of patients with good results. So.
And this is something that's going to be carried across the Hartford healthcare system. The software will be implemented very soon, so that we can transfer and triage these patients quickly.
Yeah, so if somebody comes up to one of our Hartford healthcare system hospitals, they can be screened there and evaluated with this advanced imaging, so that if they are candidates, they can be quickly rushed to Hartford to get treated, or treated locally if need be. So that provides that access system-wide.
Yep. Tell us about the imaging, because the imaging has been around. This is you've looked at imaging to detect stroke, where in the brain the stroke may have occurred, what damage or deficits might be likely as a result of the stroke. But take us through the process. A patient comes in, and you're going through that protocol to see if they qualify for these protocols.
Okay, so let's take an example of somebody comes in several hours out from their stroke. They would get a CAT scan. Everybody would get a CAT scan to make sure it's not a bleed or some other process that's going on. And then they would get something called a CT angiogram, which is a CAT scan with dye that looks at the blood vessels of the brain. And that's to evaluate if there's a blockage in the brain. And then based on that, you can look at the CAT scan and see if there's a lot of changes that suggest the stroke process has already occurred. That would just be the first thing we would do. And then the advanced imaging, which is called the rapid software, that we would do called a perfusion scan. And what that does is it measures the time it takes for the contrast material to travel in different parts of the brain and automatically calculate based on that areas of the brain that is already damaged and that is at risk for being damaged. And then you can calculate the ratio of how much is already gone versus how much is you can save. And then based on that, we would determine if these patients could be safely treated.
Right.
So that's how that works.
And how they would be treated, what course of treatment would you then pursue? Do you anticipate that the American Heart Association may actually institute these as actual guidelines in the near future?
I suppose so, because historically that's what's been happening. I mean, I would say in 2015 there have been several landmark trials that looked at what we call mechanical thrombectomy, where patients would get clot retrievals done through catheter-based treatments. And after those trials were published, similar to this trial, the American Heart and Stroke Association did publish guidelines endorsing the treatments with the criteria that would be favorable. So I suspect similarly that this trial and the other that hopefully will be published, there will be some modifications to expand that time window.
We do have a question from Carol. She wants to know if taking baby aspirin is advisable if someone thinks they're having a stroke.
Yeah, that's a very good question. We get asked that a lot. The only problem with that is, as compared to a heart attack, you don't know what kind of stroke it is.
Right.
It could be a bleeding type stroke, or where an aneurysm has ruptured, or there's high blood pressure causing leakage of blood into the brain, and aspirin can potentially worsen that process. So if somebody is experiencing a stroke or is concerned about the stroke, the best thing to do is just call 911.
And aspirin, I think, is much more preventable, right? Because it acts sort of as a blood thinner.
Correct.
Right?
Yeah, exactly. So calling 911 would be the best thing to do.
Yeah, no, absolutely. You've treated some patients with this so far, and the results have been great. Tell us about the patients.
Yeah, in the study, when they looked at that, there's something called the number needed to treat. So to have a good outcome where you would have minimal to no disability, the number needed to treat was a little less than 1 in 3. So in every 3 patients you would treat, one would walk away from their stroke with minimal to no disability at all. And so far we've seen similar results here at Hartford. So it's really been promising.
That's amazing.
Yeah.
When you first heard about this study and saw the results and sort of mulled over what this study found, were you surprised at all?
I think we were surprised. I think the stroke community was surprised. I know that there's been a lot of studies looking at different types of advanced imaging techniques to find the subset of patients that would benefit, and this study really found the right recipe, if I may say that, or the right criteria that really found the best benefit for patients.
Yeah, it seems that they got right to the core, and it was very specific.
Yes.
Like very tailored.
Very tailored, yeah.
Connor wants to know, what percentage of patients have salvageable tissue beyond the old 4.5-hour window? That's a good question. Thanks,
That's
Connor.
a great question, yeah. So I would answer it two ways. The first one would say that, let's say, what percentage of patients traditionally would present to a hospital in that beyond the 4 to 6, maybe, let's say beyond 6 hours, to just make it simple. Probably about 35 to 40% of patients who do present to hospital are either after 6 hours or the time of onset is not really clear. So if we take 40%, that 40%, I would say that a third of that 40% of patients would be patients with salvageable brain tissue.
Interesting. It's almost hard to believe that, probably 5, maybe 10 years ago, maybe even just 5 years ago, if somebody told you you could potentially successfully treat a certain subset of stroke patients within a 24-hour window, would you think, no, not likely?
No, not likely. Based on everything we've learned so far and based on our experiences, that this is going to be transformational. Nationally, internationally, there's going to be a lot of changes and a lot of hope really for our patients.
Oh, it's a big deal.
Yeah.
It's so wonderful, and it's so great that we're able to offer these protocols right here at Hartford Hospital. But I also think we hope you learned something from this, but really the key takeaway here is if you think you're having a stroke or someone you know is having a stroke, don't wait, don't hesitate, don't self-diagnose, call 911 immediately and follow that sort of 6-hour window. Let you guys determine if that 24-hour window is of adequateness.
That is precisely the key, because as we just Connor's question, is that which percentage it is. It's not everybody, and I think the earlier you come in, the more options you have.
Exactly.
Yeah.
Dr. Nouh, thank you so much.
Thank you for having me.
This is wonderful.
Absolutely.
Well, thank you for joining us. We hope you took something away from tonight's Facebook Live discussion. If you have any further questions, you can call the number on our screen. We'll get you right over to the Stroke Center, Dr. Nouh, and his staff over there. So once again, thanks for joining us. I'm Hartford Healthcare's Tina Barona. We'll see you back here next week.